celebrate Jean. We're celebrating 10 years.
Oh my goodness!
Yeah, we have to celebrate that. That was so sweet.
What a nice touch that is.
Well, we should lift a glass to you.
We should. You're right.
Congratulations.
Thank you very much.
I want to say something that, as Jean's husband, we are really lucky to have had you in the very beginning. We owe Jean's life to you and all your efforts.
Well, thank you for choosing to come to Jefferson. Because Jefferson's undergone a lot of transformation in the last few years.
I just want to say thank you all for your support, for your interest.
I have a passion to cure pancreatic cancer one day. Always looking for the next big thing.
I drive a lot of research programs within surgery with the idea that there are somatic or mutations found in these tumors, early resected tumors, that can be used to be predictive of better care in the future or predictive of tumor recurrence.
Aside from doing studies in cancer cells and mice, we also do clinical studies as well. I mean, everything you do that allows us to support the research.
Anyone on the care team who has any kind of touch point with the patient can identify that there's some potential problem that we might be able to help support them around. So a lot of range in how the fund is used, but so many opportunities, both small and large, to make such a big impact, and we truly are not able to do that without, funds like this.
We can do super cool stuff here, but we need to keep people whole.
This year, just in the last month, 400,000 in donations that we've made does grow gradually every year. We really get a lot from these events when we come here. Sometimes we need a little emotional charge or recharge. Learning about what you're doing and meeting all of you and hearing things definitely gives us that inspiration.
I tell everybody I know about that pancreatic symposium, and it has been very inspirational to me. Just seeing the passion and the dedication and the excitement of the doctors at that symposium. I think that is just something that makes Jefferson really different.
Merging these two parts of my life is really important to me. Pancreatic cancer has become a really huge part of my life and a major passion for me.
Most patients who are advanced get their tumors analyzed in sequence, and then you can kind of look at that information and see what the mutations are and test to see if there's any drugs that can be used to help target those mutations. Most of the time, patients in later stage get this for free and insurance will cover for it. But early stages, the ones that will most likely recur, do not. And so you have to wait until you recur or get to that advanced stage to get this done so that you can get the right treatment for yourself.
I want to mention that 90% of pancreatic cancers have a KRAS mutation. And out of those 90%, 30% have G12D type of mutation and only 3% have G12C. And all it does, it just, sends signals to cancer cells, you need to grow, you need to grow, you need to grow. And the drug will just, tether it in the inactive stage so it doesn't go into the activation mode. KRAS or RAS is no longer an undruggable target. There are many other types of therapies on the horizon. We want to know it early. In patients who just had surgery, although it's not part of the standard of care, but what it does, it gives us opportunity to develop therapies and helps us, we hope, improve outcomes for our patients so we can cure it.
It used to take 1 year to get the structure of one protein. Like, it would take an entire year, like one person, one lab's entire effort. One of the big benefits of AI is it's churning these out, hundreds of them a day. So all these companies can use information to create drugs to potentially inhibit those proteins. Like, we're trying to get pancreatic cancer to move into the group like breast cancer, colon cancer, thyroid cancer. Like, people have these, they get them removed, they get treated, and they're doing great 5 years, 10 years, 20 years down the road. We're not there yet for everyone with pancreatic cancer. We haven't hit the last step. For example, having a potent KRAS inhibitor that would help 50% or 90% of the patients. But a lot of these drugs, because they're constructed just to hit this one target, They're not like the chemotherapy that just wipes everything out.
You know, initiatives like GEMPAC, we don't want it to become stage 4. We want to catch it early. We want to identify what is driving it, and we want to act against it. So it never gets to the point that we're in a situation like that.
And we don't want insurance companies like dictating
How we should be treating this.
exactly.
Here, what's happening here is really, really good for us. It's inspiring is what it is.